Hi everyone, welcome to Gravitas AI panel discussion on topic lifestyle, fitness and heart health for youngsters. To discuss more on topic, we have with us Dr. Deepak Puri, Senior Director Cardiovascular Thoracic Surgery at Max Super Specialty Hospital, Bali. And joining him, we have with us Mr. Mukesh Sinha, co-founder of Gravitas AI. Welcome both of you for today's session.
Thank you.
So, yeah.
Thank you, Akshita.
All right, so going on with the first question, Doctor, what are some of the key lifestyle habits that young people should adopt to maintain good heart health from an early age?
The foremost lifestyle habit from an early age would be that we should educate the children to adopt healthy eating habits. And in that, we should encourage them to eat more fruits and vegetables and less of oily foods, fried food, junk food, and cold drinks. And as they grow older, when they become teenagers, we should educate them to refrain from falling into the trap of smoking, alcohol, and also every child should be educated to have a very active lifestyle. And because sedentary lifestyle is becoming a part of the teenagers life, because most of them, they are preparing for exams, competitions, and they are having a very sedentary lifestyle, reading all the time and most of the time spent on the net, and very little time for outdoor activities. So both of these are very important. And another important thing is that they should uh, know how to handle stress, because stress has become a part of our life and nobody can uh, claim that he's not having any stress. So we have stress, but we have to learn how to handle stress. And apart from that, we have to learn how to use our other hemisphere also, because most of the youngsters, they are spending their time on like competitive exams, and they are not sparing any time for recreations. So they should have recreations. We should value relationships. We should have good social uh, interaction with the family and with friends, so that we maintain a balanced life, and we don't get affected by the lifestyle diseases at the early age.
Of course. So, you want
So,
to add something, Mr. Mukesh?
yeah, so I think Dr. Puri has rightly mentioned it has to be balanced, or in other way, holistic lifestyle, a good eating habit, as well as I think outdoor activities, particularly exercise and other things, should be included into day to day lifestyle, so that life would be more balanced and your system would be more immune. Otherwise, we have seen many examples these days, very look like very healthy body, but all of sudden people are getting collapse either in the gym or somewhere is kind of thing there. So holistic approach towards the healthcare, towards the life is very very important.
Yes, correctly mentioned by both of you. As Dr. Puri mentioned about the sedentary lifestyle, of course, after COVID and during COVID also, sedentary lifestyle has developed too much. Like even the working professional, they have their work from home culture and they are very adapted to it. Now we can see due to that, what is happening, their day-to-day life movement is very restricted. So we should always encourage that to just take out some time, give some exercise to your body, eat healthy, and of course maintain a good relation with everyone, have a good talk, which will reduce their stress as well and give them a good heart health. So moving ahead with the next question, how do factors like stress, lack of sleep and poor diet contribute to heart issues among youngsters, and what can be done to mitigate these risks?
So this is a very important question, that most of the youngsters I've seen, they are studying in the night, and
Yes.
they are sleeping late, and they are waking up late. So this does not complete the necessary 7 hours sleep. So we need a 7 to 8 hours night sleep. Night sleep means that before daybreak. So if you sleep late and wake up late, that is not night sleep. So that disturbs the circadian rhythm, and that causes a lot of problems in our body, and that makes us at risk for lifestyle diseases like early diabetes and early hypertension and early onset of other atherosclerosis and heart attacks. So also this is likely to make us prone to having obesity. So we should have a proper night sleep, which is very important. And regarding stress, like I already told you, that stress is a part of life, but we have to learn how to deal with stress. And for de-stressing, we should have some regular activities. And it depends on the person, because some people, they have a passion for activities like painting, singing, dancing, or some people may enjoy gardening. So it depends on whatever you like. You should spend at least half an hour every day on that to de-stress your mind. And what was the third thing you asked?
Yeah, like what can be done to mitigate these risks? Like how we can help people to like lower the
Lower the
risk.
risk.
Yeah.
Okay, yeah. So to lower the risk, we should have a balanced lifestyle. And like nowadays, we see that there are two types of youngsters. Either they are over gymming, and
Mhm.
they are spending excessive time in the gym. They are lifting weights, and because of that, they are landing up into trouble. And other group of people, they are totally sedentary, so they don't do any activity at all. So both the things are very harmful. There are guidelines, like every day a normal person should walk at least 30 minutes in a day, brisk walk. And they can indulge in other physical activities. Some people who are doing high activity exercises like running, cycling, swimming, so they can do it at least 3 times in a week, 25 minutes each time. And those who do like high intensity exercises, weightlifting, etc., they need not do it more than 2 times in a week. So if you overdo the exercise, then also it makes you more prone to sudden heart attacks. And
Yes.
especially after COVID, we have seen that youngsters, they are having sudden deaths. And there is a increase in 29.9% in the age group 25 to 44 in the last 2 years after the COVID finished. So we have seen increase in the younger age group compared to the elder age group. It is more often seen in the younger sudden deaths. So the main reason is that the clot formation increases, thrombus formation tendency increases after COVID, and also the incidence of arrhythmias is also increasing, and the incidence of heart failure is also increasing. And
Yes.
it is seen that those who did not require hospitalization for COVID, the increase in that population is around 10%, 10 times. And those who needed to be hospitalized, in them, there has been a hundredfold increase in the incidence of sudden deaths. So this is very alarming, and we should take precautions, and we should maintain a very healthy, balanced lifestyle so that we don't get affected. And if we get any problem, we should immediately seek medical help rather than googling and asking from friends, relatives, and from uh, non-scientific sources. We should
Yes.
take proper advice.
Correct. So yes, of course, we have seen like whether it's on any of the extremities, whether gymming too much or exercising too much or having a very like setting sedentary job too much. Anything is harmful. Anywhere we have to lie in between. Like we have to keep an equal and a balanced lifestyle, just to like, of course, lower the risk of like growing heart attacks in the world today. Anything you want to add, Mr. Mukesh?
I think as rightly mentioned, the key word is balanced lifestyle. So when we talk about balanced lifestyle, that means your physical, mental, and spiritual health has to be maintained properly. And Second thing is stress is in everybody's life, from these days, from kids to the elderly person, because too much competitions are there, and stress is not always a bad thing, because the tolerable stress, if you do it, your productivity is in fact is going to be more. So that need to be cautiously and with proper training and other things during the education side, or when you are working in the corporate world. So you know, to understand what is your tolerance level, how much you can go, and accordingly you can adjust these things. And these things is only possible through the balanced lifestyle.
All right. Moving ahead with the next question, doctor. What are some misconceptions about fitness and heart health that you often see among young people, and how can these be addressed?
This is very important because nowadays, like, people don't know what is fitness. Like, fitness, uh, it's not a competition. So a person, fitness means that the person should be able to do his day-to-day activities, as well as be able to deal with any emergency uh, without getting breakdown. And for fitness, like, it's not just limited to your muscles. Like, in the gyms, most of the people, they are taking supplements and they are taking medicines which have been banned and which are harmful, and they are coming to us with the high blood pressure, they are coming to us with spine problems, back problems, joint problems. Many people, they require unnecessarily surgeries because they are doing exercise excessively, they are doing in a wrong posture. And, like, for exercise, you have to take care that you should know the frequency, then for how long you should do the exercise, and what type of exercise suits you, and also the intensity of the exercise is very important. And, like, somebody walking on the treadmill, like, I have visited many gyms as a special guest, and they invited me for talks, and I was surprised to find that none of them, not even the instructors, know the actual definitions of fitness and the actual parameters. So many of them, they were not falling into the proper BMI, they were not having proper waist circumference, and they were not knowing how much when to stop while doing the exercise or treadmill. Like, we should know that when you are doing on a treadmill and you are seeing your pulse rate, so your heart rate, it should not exceed a certain limit. So that limit is set by the formula that you minus your age from 220, and that is the maximum achievable. But you don't have to, you can't achieve the maximum achievable, you just have to achieve 60 to 70% of the maximum achievable. Suppose a 20-year-old person goes to the treadmill, so 220 minus 20 is 200. So out of 200, if you achieve 120 or maybe 140, that is the maximum you require for normal person. So some athletes, like, if you're training for a competition or some tournament, then maybe you can exceed the 70% limit. But once you cross 80%, that means that you enter the danger zone. So
Yeah.
if that person crosses heart rate of 160, that person has entered the danger zone, so that is harmful. So many people, they are not able to tolerate that, and sometimes there are artery cracks and clot formation starts, and later on they die suddenly because of the heart attack. And sometimes a person may be having some conduction defect or some congenital problem, or some other hidden problem, which may not be apparent. So before you start any exercise program, you should first consult a proper expert cardiologist to know the status of your heart. And also, you should get yourself like, screened for the risk factors, what risk factors you have. And you should not take unnecessarily any supplements or any products which have been banned. There's no need to take such excess, because many people, they take excess proteins, and
Yeah.
they later on come to us with the high creatinine levels, and which is rather very harmful. They are damaging their kidneys because there is a limit of your daily requirement of proteins. And also you have to build up your not only your physical fitness, you have to build up your mental and your social fitness also, because most of the people who are gymming may not be mentally fit and may not be socially fit.
Yes.
So
All right.
actually, they don't have the endurance. They just have that. They try to build up the muscles with the help of anabolic steroids, high proteins, and dietary supplements, which is actually not helping them. It is rather harming them.
All right. Thank you, doctor, for sharing the formula that how much we have to do in the gym, like how to calculate the pulse rate and what is the required amount of exercise needs to be done to. So, of course, this formula will be very helpful for our audience to know things better. Moving ahead with the next question we have with us, like, can you share some practical tips for young professionals or students with hectic schedules to integrate like heart healthy habits into their lifestyle?
Definitely, like nowadays, we are all having very hectic schedules, and also sometimes we not may not get proper food at proper time, and we may not get enough time to relax and to exercise. For them, I would like to say that first of all, you must start loving your work. Like if you enjoy your work, then you will not feel tired, and you will not have too much stress also. So whenever there is a emergency or if there is a very stressful situation, first of all you should know how to deal with the situation with a cool mind. And like small things you can do whenever you get time, like in the office also, instead of taking the lift you can take the stairs, and instead of like parking the car just next to where you are going, you can park it at a distance and walk a little. And also you can do small things, like you can get up from your seat every half an hour or so, or at least after 1 hour, take a small walk and then come back, because prolonged sitting is also a risk factor nowadays. And
Yes.
you should find out time, like when you are walking in a park, you can listen to music. It will relax you also. And walking a park is much more de-stressing. It activates the parasympathetic system rather than going to the gym and walking on the treadmill. Many people they prefer to the treadmill. There's a lot of sympathetic drive there. People are competing with each other, and the trainers also they create a competitive environment, that that fellow has done this thing and why you're not doing this thing. So that produces a adrenaline rush in our blood. And many times, like some people they go to the dance class and they also they stress themselves out learning difficult steps. So there's no need to do that. If you go for swimming, then you're not, if you're not a uh, professional swimmer, and if you're not going for the Olympics, then there's no need to stress yourself out. You can go there and relax and de-stress yourself and then come back home. So we should not compete in each and every activity that we do. Even when we are relaxing, then also we are most of the time competing. So that is a very bad thing, and that is why we are burning ourselves out.
Mhm. All right. So, any tips from you, Mr. Mukesh?
No, I think he has shared in the details, but I would say a disciplined life and anything excess is always bad. And little bit cardiovascular exercise, and you can do it in the gym or you can do it in the home itself. Like pranayam, another thing is also good exercise. Meditation is a good exercise to distress yourself. So these little things, but it has to be on regular basis. That will
Yes.
help to have a balance and a disciplined life.
Of course. So, thank you both of you for sharing tips. Moving ahead, like what are some emerging trends or technologies in fitness and healthcare that can help the younger generation safeguard their heart health?
Emerging trends, like nowadays a lot of information is available everywhere on the net, and a lot of people, self trained people, they are teaching how to keep yourself fit, and
Yes.
most of the people, they are falling into that trap. So I would like to say that we have to use the technologies in a very scientific way. And like most of the times, like first of all, you should know that in our life we should balance the amount of calories we consume with the balance with the amount of calories we burn. So if you are able to use some kind of apps where they guide you regarding how many calories you have consumed and how many you have burnt, so
Mm-hmm.
then we can maintain a balance. And
Yes.
also, like, uh, we can identify our risk factors. Like, we have made a simple performa uh, which is available on our websites also, and we have
Mm-hmm.
a QR code also for that. So if you
Mm-hmm.
just fill that performa, it screens your lifestyle, and
Okay.
we can tell you what risk factors you have, because nowadays, just from the young age, we are building up a web of risk factors around us. Like a spider weaves a web and then falls into the trap. Similarly, we are falling into that trap, and multiple risk factors slowly they are entering our lives, and we assume that this is a part of life, and suddenly then someday we are told that you are having this problem. And many people, they get routine screening tests done, multiple screening tests done, and all the reports are okay, but after a few days or a few weeks, then we find the person suddenly died. So
Mm-hmm.
we should understand that all the screening tests, they can only identify when the problem is already apparent, and there are
Mm-hmm.
many other lifestyle risk factors which can be screened through simple questionnaires. And if there you have multiple risk factors, then maybe you should consult an expert person who has the scientific knowledge, and then get yourself examined, because physical examination, your history, and your risk factor screening all combined will accurately define how much risk is there for you for the future, like in the coming 10 years, 20 years. So if you take proper advice, then you can protect yourself from falling into the risk. Otherwise, what is happening nowadays is that people are blindly following each other, and they are
Mm-hmm.
following advice from the net, which is totally confusing, and sometimes it is contradictory to the actual scientific evidence. So that is very harmful. And you cannot generalize the advice, like every individual is different, so it has to be properly tailored for a particular person. You can't generalize that you should, if you do this, then you will be risk free.
Mm-hmm.
So it depends from person to person, from the community you belong. And like Indians, they are more prone to heart diseases compared to the Japanese. Our risk is 20 times more. If you compare to the Chinese, our risk is 6 times more, and it is 4 times more compared to the Americans. So among communities also risks are different, and then we have to know um, how much is our BMI, how much is our waist circumference, because waist circumference is nowadays very accurate indicator of your lifestyle disease risk. Because Indians, they may be having a normal BMI, but we have more abdominal fat. So otherwise person may be having normal weight, but there's more fat in the abdomen, in the belly. So this is a very important risk factor for lifestyle diseases like diabetes, high blood pressure, cancers, and heart attacks. So we should know that our waist circumference should be less than half of our height. So this is a very simple formula, and if you just calculate your waist circumference and your height ratio, then if it is more than half, that means then you are having a more risk. So then you have to control your waist circumference.
Of course. All right. So by this, we comes to an end today's session. So thank you, doctor, for summarizing everything and giving us all a very helpful tips for young generation to adapt. Of course, a very like a good lifestyle, a balanced lifestyle, and plus, of course, a disciplined lifestyle is very much required to keep not only the heart health but the overall body healthy. Okay, you want to add something, sir?
These days a lot of IoT devices are available there, like wearable watch and many others. Even apps are also available in the mobile and other thing. But Dr. Deepak Puri has rightly mentioned it has to be evaluated scientifically, and any suggestion and anything has to be done through the authorized, medically certified. Just in our case in the chatbot, like it's a authorized, certified by the doctors kind of information. Google information may be right and may not be right. So you can do trial and error in other things, but you should not do it particularly as for the healthcare is concerned.
Of course.
So very important point, Dr. Deepak Puri. And of course, it's a good combination of technologies and knowledge. Then particularly lifestyle, you can say it is more adaptive, and you can, based on the expert suggestion, you can change your lifestyle.
All right. So, thank you, doctor, for joining us today and giving us a valuable insight about the health and giving us your time, which is very helpful for us as well as for our audience as well. So, thank you, doctor. Thank you, Mr.
Thank you
Mukesh,
so
sir.
much. It was a great pleasure, and I hope that people who are listening will adopt the advices we have given today. And
Mhm.
also, I hope that this information keeps on spreading far and wide, because 80% of the cardiovascular problems, they are preventable, and
Correct.
just by adopting simple lifestyle changes, we can prevent so many mortalities and morbidities. Thank you.
Correct.
Thank you, doctor. Thank you, everyone.
Thank you. Thank you.
Thank you.